90% of the work, the benefit, the recovery that you're going to get from your sciatica comes from the education and the rehab work at home. That's where you literally change your body. The interface that someone else has, maybe it's a massage, maybe it's an adjustment, maybe it's osteopathy, maybe it's an injection, maybe it's a microdiscectomy to take a bit of that disc away. Those are small interventions which you can then go home and re-aggravate. The amount of times we get people, for example, commenting on our social channels saying, well, I had a discectomy 6 months ago and now I've got an L4-5 disc bulge instead of an L5-S1, or the disc bulged on the other side. And this again goes back to that expectation, the false expectation of that treatment, and the absence of awareness that actually the pyramid that makes up our back rehab, our recovery from our sciatica, needs to be 90% done by us at home every single day. Now, if you started making significant work on the rehab front, then sure, leveraging specific treatments to offer you support, targeted intervention can be an absolutely fantastic supplement to the sustenance that we get from our rehab. To view it is a food analogy. It's no good trying to survive on vitamin D supplements and zinc pills and try and have good health if we're not actually eating the food first. We need to focus, for example, on getting a good diet, getting the raw materials that our body needs, the protein, the carbohydrates, and the fats on board on a daily basis. And then that little extra bit is going to maybe be through some supplementation and some additional resources. And just like with our recovery from sciatica, the baseline is the stuff that affects us every single day. It's the learning to move correctly. It's the greater conscientiousness about how we use our body on a daily basis, especially in those early days, to make sure that we're not tripping ourselves up every single day, aggravating this disc and preventing a complete and continued recovery from occurring and healing in that disc. And then we supplement that with an intervention from the specialist, from the osteopath, chiropractor, the acupuncture session, etc. This is why our viewpoint over the years has changed in terms of the role of treatment, because as a osteopath, you are taught, as a chiropractor, I'm sure it's the same, and as a physiotherapist, you're the same. You're trying to intervene and help the patient. The surgeon is trying their best to help the patient. But actually what we've seen is that with patients that come here now, you've got to do the rehab work before you come in and have a great IDD session on the table down there, or we do some laser to help you. You have to do that, because it's no good if you then get up, round your lower back to pick your bag up at the end. If you even thought to put your bag on the floor, or often didn't think to put your bag on the floor, the way in which we get in the car afterwards, these little things need to be fixed first before we go and have a treatment that can help us, only to unfortunately undermine what we're doing by the way in which we conduct ourselves after the treatment.